Morning, everyone. Thank you so much for joining in this morning. I'd like to start by acknowledging the traditional owners of the land on which we meet. For me today, that's the Gunditj Mara people. This will be different for all of us, but I encourage you to have a think about the traditional owners of the land on which you are right now, as we pay our respects to elders past, present, and emerging. My name is Jen Rowan. I am a young person. I'm 24 years old, and I am tuning in today from a tiny little town on the Great South Coast called Camperdown. I am a casual employee of YACVic, the Youth Affairs Council of Victoria, and I'm so excited to be here today. Alongside me, I've got Mel. Would you like to introduce yourself, Mel?
Hey everyone, so my name's Mel. I'm very excited to be co-hosting this event with Jen today. I'm a young person with a lived experience of ill mental health, and I'm on Orygen's Research Review Committee and Youth Research Council. Today I'm calling all the way from Canberra, and I'm so excited to be talking about this very important topic. As many of you would know, the Royal Commission into Victoria's mental health system has recently announced that it'll now release its final report in early February 2021. So that's after a 3-month extension. In this Youth Mental Health Community of Practice webinar, we will be joined by 2 commissioners from the Royal Commission. That's Penny Armitage and Dr Alex Cochrane, who will provide an update and answer your questions. So just before we begin and get this show on the road, a quick word on the community of practice. The Youth Mental Health Community of Practice is co-convened by YACVic and Orygen, and it holds regular events to share information, facilitate learning, and create connections across the youth mental health sector, as well as other sectors that have a role to play in supporting the mental health of young people. This webinar is part of a monthly series of webinars exploring the most important youth mental health policy issues and the ways in which we can work collectively to address them. Following this webinar, you'll receive an invitation to join the community of practice. So please join us if you are interested in being a part of future events. And I'll just pass it back over to Jen.
Thanks, Mel. Before we get into it, a bit of a content warning. This webinar will include some discussion about difficult themes such as mental health and suicide. Please feel free to jump out of the webinar at any time, and please feel free to reach out if you require any assistance at all. I might hand it back over to Mel for some Zoom etiquette.
Wonderful. Back over to me again. So just a quick note on how we're running the webinar today to ensure everything runs really smoothly. Firstly, we have a commitment to inclusion and accessibility, and this event is being Auslan interpreted by 2 wonderful interpreters, one of which you can see at the moment, and they will remain on screen and visible throughout the webinar. You can pin the video of the interpreter to ensure they remain on screen for the duration. Secondly, due to time constraints, only pre-submitted questions are able to be answered by the commissioners today. If you have any further ideas, you can put them in the chat and these will be sent off to the commissioners, who will endeavour to provide a response sent out to everyone after the webinar. The same goes for questions which are not able to be answered today because they were submitted after the deadline a little while ago. Finally, because this is a webinar, not a meeting, only speakers need to be aware of self-muting and background noise. So on that note, I'm very excited to welcome and introduce the 2 commissioners who will be joining us today. I'll introduce these wonderful people. That's Penny Armitage and Dr Alex Cochrane, one at a time. So firstly, Penny Armitage is a chair of the Royal Commission into Victoria's mental health system. Penny has provided over 30 years experience, service and leadership to the community and has vast experience in managing public policy and service delivery in both the justice and human service sectors. Originally a social worker, she has become a highly regarded public sector leader. having held leadership positions on various boards and advisory committees. Penny was recently made a member of the Order of Australia, which is so cool and fantastic, so congratulations, in the 2020 Queen's Birthday Honours. And now to Dr. Alex Cochrane. Dr. Alex Cochrane is a psychiatrist by training, a clinician and leader in mental health and acute health care. Dr. Cockrum was Chief Executive of Western Health from 2012 to 2017 before joining the board of Epworth Healthcare Group. Dr. Cockrum has provided government with strategic advice on system reform in areas including mental health, alcohol and other drugs, and the NDIS. She has been an advocate for workforce training and development that supports better patient and community outcomes. So thank you so much to Penny Armitage and Dr. Alex Cochrane for being with us today. And I'll now hand it over to Penny to give us an update on the Royal Commission and where it's at. So over to you, Penny.
Thank you very much and good morning, everybody. And thank you, Jen and Mel, for the introduction. I would like to begin by also acknowledging the traditional owners of the lands on which we meet today, located across Victoria and any other states people who are joining us today. I pay my respects to elders past, present and emerging, and extend that to any elders who might be joining us here today. I would also like to acknowledge the young people with us today that have a lived experience of mental illness or suicide. I want to acknowledge how valuable your voice is in today's discussion and to the Commission as we design Victoria's future mental health system and our response to suicide prevention and response services. I and my fellow Commissioner, Dr. Alex Cochrane, are very much looking forward to our discussion with you today. It is an excellent opportunity for us both, along with Professor McGorry, as the chair of our expert advisory group, to better understand directly from young people what you think are the top priorities for change to our existing youth mental health system. As mentioned, recognising the interruptions that have been caused by the COVID-19 virus, the Premier recently granted the Commission an extension, with our final report now due on the 5th of February 2021 rather than the 30th of October 2020. This short extension will allow the Commission to continue our engagement and will provide us with some additional time where we can fully understand the priorities for change and our practical solutions that we think are required to improve the state of our mental health system. The Commission is very conscious that you are our next generation, our future. Your mental health is essential to your quality of life, to your family and loved ones, and to the important contributions you make to our economy, our community, and our society. We know that if not identified quickly and treated effectively, poor mental health at a young age can have a wide-ranging and deep ramifications in many aspects of your lives, including education, employment, independence, social participation, and connection. We are also conscious that adolescence and young adulthood are high-risk periods for the development of mental illness, with an estimated half of all lifetime mental health disorders presented by the age of 14 and 3/4 present by the age of 24. I think that those statistics alone underscore why it's so important that we're having today's conversation. We know that this time in your life has a considerable bearing on your opportunities to experience good mental health throughout your life, and that timely access to quality mental health treatment and care when you are at risk of mental illness or early in the onset of mental illness is vitally important. We also know that access to care that is developmentally appropriate in settings where you feel safe, understood and heard leads to better clinical outcomes and better experiences that aid recovery and promote future help-seeking behaviour. And we are conscious that mental health was recently ranked in a survey of young people as the most important national issue. While we know that some young people have positive experiences with our mental health system, unfortunately, we also know from the submissions and the engagement we have had with young people that the voice of these young people have said that far too often our youth mental health system isn't always as accessible as it should be, and that some young people feel that their need for treatment, support and care either is missed out on, and they don't receive that care and support, or they get a shorter duration of treatment than they need to recover and support, or are provided with care that isn't as appropriate and as responsive as it should be. So collectively, those voices are telling us that we've got a need to make change. We also know that care is not always integrated around each young person's need, meaning young people often have to access multiple services to get the help they need, particularly drug and alcohol and physical and sexual health support services. And we also know that because care is not integrated, young people have to retell their story multiple times, and this can be very distressing and traumatic, and young people have told us it's often very triggering for them to have to repeat that. We recently received a statement from a young person, Kaiba, who is 21 years old and bravely shared their experience with our about the mental health system. Kaiba told the Commission, "I felt like they were saying there was nothing wrong with me. When someone is telling me that, I kind of think, okay, nothing's wrong, so it's got to be me. It made me feel like maybe I was making it up. I was beginning to believe that I had somehow made all this up in my head and that there was really nothing wrong with me. Perhaps my mind is playing tricks on me. And then I kind of go into self-destructive mode and spiral out of control and attempt to self-harm or suicide again. So I guess the more I got dismissed, the more vicious the cycle became. I later discovered I wasn't making it up. I have borderline personality disorder. They should have helped me." So that's just one statement from one individual who's contributed to our Royal Commission, but sadly it's reflected in many sources of the feedback we've received. We must use the opportunity that the Royal Commission has to change this, and we want to do this in collaboration with young people so that the change we create results in a better clinical outcomes and experiences for all young people and is enduring. Professor McGorry, Commissioner Cochrane and I are excited about the opportunity to hear directly from young people today about your experiences and your priorities for change and to respond to the questions that you've put to us. Thank you, Jen and Mel.
Thank you. Thanks so much for that update, Penny. We're now going to hear from Professor Pat McGorry, who is the Executive Director of Orygen and Professor of Youth Mental Health at the University of Melbourne. Professor McGorry is a psychiatrist known worldwide for his groundbreaking work in early intervention in youth mental health. His work in mental health innovation, advocacy and reform, and his leading role in the development of Headspace. For his work in these areas, Professor McGorry was named 2010 Australian of the Year. Amazing. So thanks so much for joining us, Pat. I'll hand it over to you.
Thanks very much, Jen and Mel, and hello, Penny and Alex, and hello, everybody. And we really appreciate the opportunity at the Commission to connect with you in this way. So thanks to YACVic and to Orygen for setting it all up, and thanks to Penny and Alex for making the time to do this, because it's incredibly important to talk with young people. And it's probably more important to listen than talk, so I'm not going to talk for very long. I just want to basically say how much I appreciated Penny's comments and the Commission, just to give people a sense of confidence. I've been incredibly inspired by being able to be part of this. I've got tremendous confidence in this Commission to actually really make the once in generation change that we desperately need in Victoria. As our Premier has said, he's the most honest politician when it comes to mental health. He's described our system as broken, and I've just watched it, as Alex has, working within it for the last couple of decades. We've just watched it crumble, and it's let every Victorian down, really, I think, in the process, despite the best efforts of the clinicians and the people trying to keep it together over that period. So, but as a society, we've recognised that something serious has to be done to fix it, and that is actually happening within the Commission under Penny's leadership. So it's really a great time, even though obviously there are a lot of worries in the world at the moment, a lot of difficult challenges we're facing. But, you know, at least the Commission is a bit of a a source of hope and inspiration for a better future around mental health. And as Penny said, young people, bear the very heavy burden of mental ill health, the onset of it, which is why we focused for so many years on trying to build systems of care that really sort of reduce the impact and actually, give young people the best chance of recovery from their main health problem, which is mental ill health. And ironically, Victoria is the place in the world where all of that kind of innovation and progress has actually been made through, the development of Headspace that Jen mentioned, and also at Orygen we have, a collection of talent and drive and motivation and energy powered by young people as well through, our Youth Research Council, which Mel is part of, and the voices of young people shaping the service delivery. But the problem is that, what we have is definitely, evidence-based and working, and through the co-design process, very, very positive culture, but it's too little, and too little too late. At Orygen, we turn away 3 out of 4 young people who need our help for more specialised forms of mental ill health. And Headspace's waiting lists have extended out, even though Headspace is a great entry portal for young people. It's a trusted brand, but young people are having increasing difficulty getting into the Headspace open door because of the level of need in the community for young people to get that sort of help. It's their main health problem. I think we estimate something like 90,000 young people in our catchment area of the Northwest have a need for some kind of mental health support or care. It doesn't mean they all have to come into mental health services, but it's a very, very widespread problem. So the scale of the problem has not been appreciated, but at least we are now working out mechanisms and ways of developing the right type of culture of care with respect for scientific evidence and research, and the need to innovate and create new knowledge, but also to kind of have it as a holistic sort of framework. So all of the needs of young people are met, not just a very narrow clinical perspective. Of course, the clinical perspective is very important because that's where the scientific expertise can be brought to bear, and we need new discoveries, new innovation there too. But integrating all of it, as Penny said, is the key, and that's what we're going to do. We've got a national plan as well, and we have to have a statewide approach to youth mental health, so every young Victorian has reliable access to the best quality of care, just like they would if they had lymphoma or some kind of medical problem, asthma, any other medical problem they would have in Victoria. They're probably going to get very high quality care as a young person, but their main health problem, they've got to be able to be confident they can get that addressed in a very expert way too. So I think I'm feeling pretty confident about the future, being in this state, and obviously look forward to your thoughts and your feedback on what we should do, which the Commission's been very, very keen to hear. So I'll stop there. Thanks, Jen and Mel, and back to the young people, hopefully.
Thank you so much, Pat. That was great to hear from you. All right, we're going to jump into some questions now that Mel and I have. So these questions are for Penny and Alex. If perhaps you can jump back on Zoom, Penny and Alex, and we can see your faces. There you are. Awesome. So yeah, Mel and I are going to have a bit of a discussion with Penny and Alex. I think I've got the first question. It's about co-design, which is so important. We know that young people want to be involved in the ongoing design and management of the mental health system and services. And my question is, how do you see young people working with and being involved in the co-design of systems transformation following the Royal Commission?
Thank you very much, Jen. That's a great question. When the Royal Commission gave our interim report to the government in November of last year, we said in the design of the future mental health system, the voice of the consumer, those with lived experience, their family and carers, would be at the heart of our redesigned mental health system. And we thought that was a very important commitment that we gave, because when we look back and say The system that we have in place today is a system designed in the 1980s and 90s, and whilst it's had great many strengths, it's no longer relevant for some of the needs of particularly young people and the way in which they want to access support and services going forward. And so we have embarked on a process where in our deliberations, we are engaging with co-design. We are asking for people with lived experience to give us advice on how they think the system should be designed into the future. We've got expert advisors who are a part of PAT's expert advisory group who are giving advice to us. We also have people who are appointed who work alongside us in lived experience roles to give us advice and to challenge our thinking. And we've been engaging in a wide range of processes such as human-centred design. And I think Jen, you and others have helped us in terms of that process to make sure that when we, the 4 commissioners who are responsible for providing this advice to government and influencing this future system design, take account of what people are saying is needed now and into the future. And that's proved to be incredibly powerful because it's moving away from what has been historically driven by experts in the field in terms of public policy and system design, and now sharing that with those people who have the most direct impact in terms of the system, those who are going to need to access it now and into the future. And so those co-design principles are being very strongly embedded in our current work. And when we structure our recommendations for the future, given the commitment we've already made that the lived experience should be at the centre of our redesign system, we will be working out how to structure our final recommendations in a way that embeds that as part of an ongoing process. And already the implementation office that has been set up by the government to give effect to our interim report recommendations, the 9 initial recommendations we made, is embarking on a co-design process as well. So they have heard our message and they are committing to being able to do that. And I think the challenge is to acknowledge that our system has to keep evolving. The needs of young people are changing, the way in which they want to and need to access services and supports, the form they want it to take, are very different depending on their particular circumstances, their cultural background that they might be from, the nature and needs of their services, their family and circumstances, and where and how they want to access those supports. So us responding to diversity is going to be very important also, and the diverse ways in which people are going to want to engage. So Alex has also been very committed to this, so I'll ask her to add some comments in terms of the approach that we're taking to co-design.
Thanks, Penny, and so good to be here with everyone today. I'm just thrilled that YACVic and Orygen could bring this together. I think one of the really important things for us to think about is how do we embed not just the lived experience in the design components, but in co-production, so in the ongoing implementation and generation of the services and system over time. And so that's been very much a part of our thinking. And part of that comes back to ensuring that not only are we consulting broadly with people who are using service systems, but we're embedding people with lived experience across all aspects of the system itself. So in leadership roles, in roles that do evaluation, like Mel's role in research, education, across all of the components so that that voice is an ongoing voice. And, you know, the Commission exists in a 2-year time frame. What's really important to us is what's the ongoing impact of how we've been able to, I think about it within the Commission that can go on beyond it. So we're really ensuring that that's actually a very key part of what we're thinking about and part of our recommendations.
Thank you very much, Dr. Alex and Penny, for that response. As a young person and somebody who is involved in co-design and co-production, what you're saying is really heartening to me, and it really sounds like the Royal Commission genuinely and wholeheartedly backs youth co-design and what that really means, and the power that it holds. I actually have a quick follow-up question before I take it a whole new different direction. I was wondering, because in my experience as a youth consultant and youth advocate, there are certain types of young people who are, it's more difficult to capture their views or to get them involved in those sort of roles that you're referring to, say like the expert advisory committee. And there's a lot to unpack there. There's so many different types of young people. In particular though, my question today, or follow-up question, is about the younger young people, say like 14 to 16-year-olds instead of 17 to 25. I do believe that they have different needs in the mental health system, and I was wondering what the Royal Commission has done to capture their views.
That's a really good point. I think we can't presume that everyone is the same in terms of their stage of development and their willingness to be involved in those very outwardly facing engagements that we sometimes have. This issue is at the heart of what sort of youth mental health response we need to have, and the Commission's grappling with what is the age cohorts that we need to focus on, 12 to 25, for example, and what are the different developmental stages and needs of people during that stage. At 14, that younger age cohort is more likely to be engaged in school, and that will be a primary area of support in terms of their level of involvement. And so we're having to think about how we might engage with those young people differently now and into the future. And so far, their voice to us has been through their individual participation, where they have themselves wanted to make known their views, for example. But it is harder for them to engage with this sort of process because it's a much more formal process. And I think it's fair to say, typically, the young people who have been working with the Royal Commission and influencing our thinking at the moment, either by their individual submissions or other things, have largely been people who have been confident to put in writing to us or engage in one of the other processes that we've had. And so they've tended to be a bit older. And so I think that's something we're going to have to think through in our future co-design. How do you get the voice of younger people involved in that process? But Pat, I know you want to add something to that. Do you want to make
Thank you. Yeah, thank you, Penny. Yeah. Well, we've spent a lot of time working with young people to co-design a statewide model, which we've submitted to the Commission, and along those lines. And all the issues that you just mentioned, Mel, were covered there. I suppose the big choice is, can we, in line with the 15-year experience of Headspace and in 14 different countries now, shift the transition point from 18 to 25? Because everyone knows that 18 is a terrible time to have this hard transition. That's the key decision that has to be made. Of course, a 12-year-old is different from a 25-year-old, but the 12 to 25 we found, in youth mental health over the last 15, 20 years, that is a kind of a cultural group, much more so than sort of mixing primary school kids with secondary and tertiary school education levels. So there's kind of sort of big picture decisions that have to be made, which fortunately young people have really shaped it already in a huge way. And everywhere where these programs have been rolled out in the world, young people have been at the forefront of that process, like Penny was saying, and Alex was saying, at the center of it, and had a big role. So we're guided by the young people, actually, and also by the evidence, by the scientific evidence too. But you want to have flexibility, like you said. It's not a one size fits all. And we often make the mistake of generalizing about young people, like young people as if they were one thing, but they're clearly, they're people, they're incredibly diverse. So we've got to build that in too. So I really appreciate the chance to say that.
Thanks, Pat. And I guess just in closing on that, I think we are hearing and we are having a panel discussion later today where we will hear a bit more from what the level of need is. And Pat said in his comment how so many more people are presenting in distress and asking for help. And we know that they are presenting younger. So more people are putting their hand up earlier to say, I'm struggling, I need help and support, and we've got to design a system that allows them to ask for that help and then responds in a way that's going to be appropriate for them.
Totally. Thank you Penny and Pat for your responses there. It's good to unpack what the term young person really means and how you can get them involved in different ways. Yeah, it's good to hear what's been going on. We do have to steer the conversation in a different direction though, because there's so much to cover. So I have another question, which is about access to care and social factors that play into that. So my question is, socioeconomic factors such as unemployment, poor housing, and living conditions are known to be, oops, that was an email, sorry everybody, are known to be risk factors for mental ill health. At the same time, these factors are known to be barriers to accessing treatment. Young people are particularly hard hit by this problem. How does the Royal Commission plan to address the lack of affordable treatment for young people? And definitely a more complicated thing that is a part of it, I reckon the prevention, if the Royal Commission has any plans from that bottom up side of things, that would be fantastic too. So over to you guys.
Thank you very much, Mel. I guess I'll start with the prevention angle first and then go to the issue of cost. We have looked at the trends in relation to the prevalence of mental health, the earlier onset that I talked about earlier, and the growing need that our community faces, and the enormous toll it takes on individuals, families and communities, and said we have to do what we can to prevent those levels of distress in our society and in young people. So we are looking to how do we also build a better public health approach, a more community engaged approach to preventing some of these difficulties from escalating to the extent that someone has a mental illness. And we're really invested in that and doing a lot of work to think about how do you drive that? How do we help to reduce the stresses that are creating some of these additional burdens on young people? And we know that some of those, what you described as poverty, lack of stable housing, a whole range of factors are what people call the social determinants that contribute, don't necessarily cause in all instances, but contribute to levels of distress and mental illness. And we're needing to think about how as a society, in the recommendations we put forward, do we best address some of those issues. And they're very challenging and very hard to think about what do we do, particularly as we would think about now in a pandemic environment and post a pandemic, with Victoria being in a recession and unemployment potentially being even greater. How do we design a system that does more to support our community members, including young people when they're vulnerable, to prevent some of the onset of these challenges? And then for those who do, need help, how do they get it in a way that's affordable? And that point that you raised, Mel, about the cost of treatment, care and support is very, very challenging, because we've heard from so many young people that if they don't have independent income or family support who can pay sometimes the gap to even get access sometimes to primary care, let alone a specialist clinical response, how do they do that? And so this issue of trying to reduce some of the cost barriers to getting access is obviously very real, and people have talked to us constantly about the real challenge. Do they, if they're on a New Start allowance, for example, do they prioritise paying their rent and getting food, or going to see a clinician, a psychologist or a counsellor, or someone who might charge a gap? And I think that's a really distressing situation that we've found ourselves facing, where young people are having to make choices between their day-to-day costs of living and their mental health and well-being. And that trade-off is really unacceptable, but it's a very real challenge for us to think about how in our society do we design a system, and this will be an issue of joint concern for the Commonwealth as well as the Victorian Government, where it is equitable, where people have a level playing field in being able to access mental health supports when and where they need them. And that is an ongoing design challenge for us. We can't say there won't be a gap, because the whole thing about availability of mental health supports is something that we're having to look at, but we really are trying to address how do we reduce the disadvantage that some people experience in our current system, if they're not able to access additional financial support and access the private mental health system, how is the public mental health system better able to respond to their needs? Jen's going to come in there, she's just having a few challenges.
Sorry about that, Penny. I couldn't unmute myself for a moment there. Thanks so much for that response. I have a question now about digital and online services. I have a particular interest in this being from a rural area. I know stories of young people trying to access telehealth and they have to go way back into the back paddock and climb up to the top hay bale just to access good internet. And so we know young people often say that services such as telehealth is a nice option. However, many young people, especially those in rural and regional areas, tell us that they can't be a replacement for face-to-face services. And my question is, how do you think online services should be included in the mental health system?
Thank you very much, Jen. I guess when we're designing our future mental health system, we think inevitably it will have to have a significant digital presence. When we think about how people today, not just young people, all members of the community are wanting to do their interactions, when you look at where do people first turn, sometimes when they have starting to experience mental challenges and mental health challenges and feeling distressed, they'll often go to Google first. We know that in reality, that's where people will often start their journey of help seeking, not always, but very often, of all ages. And so we are having to think about what is the best way to have a balanced system? What do you need to have in an online environment? So what needs to be broadly accessible, advice and support that might be available that people will select. And sometimes people will prefer that because it's anonymous and they are happier to be anonymous at the beginning or at some point in their engagement. But then also about what place does telehealth have in a future mental health system? And I think we have looked at the uptake of telehealth, particularly in the current environment, and it's been absolutely enormous in terms of getting more access to people and that in the past sometimes haven't been able to afford it. It's clearly more accessible for them from that point of view, provided they have the internet coverage that you're talking about, Jen, provided they have the devices and means by which to engage. But it is going to be an ongoing feature of our redesigned mental health system, not just because it's cost effective, but because it is responding to the needs that many people have. And we've been hearing a lot of positive reports about the value of telehealth. People who are really struggling at times in their lives to, let's say they've got both a mental illness and a drug and alcohol problem. We're hearing from some of the AOD services that some of their consumers are finding it easier to access some of the support through telehealth. So we're really open to seeing what's the benefits that telehealth can bring to those who need to access mental health support. But we are very mindful that it's not either or. There is still a very great need for face-to-face interactions. And as we was acknowledging, we are very social creatures and very often we need to have that interaction with a person who has direct contact with us and who can really empathise with what we're going through and needing to experience and then provide that guidance and support. So face-to-face services are still going to need to be provided, and we're going to have to think about how we do that across Victoria, including regional and rural Victoria, in a much more accessible way for young people. And so I think we're probably inevitably going to have a system that acknowledges that there will always be a very strong digital presence. People are looking to the digital world for solutions in relation to this space, and lots of innovation is happening there. If you look even just to the advent of podcasts and other forms of support. It is where a huge amount of activity is occurring, not just by government, but by individuals and groups who are getting very active in the mental health space and coming up with some really innovative solutions. We had a meeting the other day with a whole lot of entrepreneurs who are involved in this space, and it was really exciting about what they're doing and what they're seeing by way of setting up online supports and digital tools and the like. And in addition, though, the challenge is, as you said, Jen, how do we keep it balanced? How do we make sure we capture the advantage of the online world and telehealth and digital health, but at the same time preserve the important face-to-face interactions that many people want, both with peers, with clinicians, with support groups and others. And our challenge is to design that system that has all three very present in terms of the response that we have.
I might jump in and take us to the next question. Thank you so much, Penny, for responding to Jen's wonderful question that's just been heard, but we do have to keep track of time. This one is a big one, so I'll try and keep it as focused as possible, and it's about cultural diversity and having culturally appropriate services. I have heard many members of the culturally and linguistically diverse and Aboriginal and Torres Strait Islander communities speak up about the importance of having diverse representation in the mental health workforce. So that's psychologists, social workers, psychiatrists, the whole board. And I also read an article by the ABC in 2019 that said the number of those people in those kinds of roles was very, very low as something like 8 last year. So it's a really, really big issue. What is the Royal Commission doing to improve the representation of CULD and Aboriginal and Torres Strait Islander communities in the mental health system broadly? And just quickly on top of that, another thing to mention is I think it would be really cool if the Royal Commission could think outside of the box of the mental health system that we've got at the moment, because it is a very Western-centric model, and I've heard of some really cool and promising ideas from, say, the Global Centre for Mental Health Learning. They had something called a friendship bench, which many of you might have heard of, running in Zimbabwe, where they worked with a community. So grandmothers who were already the type of person that someone would talk to, they were becoming part of the mental health care there. And I think it would be really amazing if the Royal Commission could work collaboratively and think outside of the box to hopefully not only improve representation, but also make sure that the services are appropriate. So that's my question for today.
Thank you, Mel. And I guess I'll start again with the end of it and then make a few comments and then ask Alex to add to it. I think thinking outside the box is very important for us. We have to design a contemporary mental health system, and the government has committed that they will implement the recommendations that we make. So we don't want to be just stuck to the existing paradigms around how best to design a mental health system, and we do have to think very laterally about what a future contemporary mental health system for young people might look like. And things like those friendship benches are the sort of ideas. What are the different ways that you can capture the interest and commitment there is, both in the formal and the informal system and in our community more broadly? And the benefit you get from that is much more help seeking, but also a reduction of some of the stigma that currently exists around mental health. And in terms of what we're doing specifically about workforce diversity, I'll just make mention of what we highlighted in our interim report. In our interim report, we focused a lot on the needs of our First Nations people, our Indigenous people and our Koori community here in Victoria. What would we need to do to respond to their calls for reform and their cultural requirement for an emphasis on social and emotional well-being rather than mental ill health and mental illness? And we did respond to that, and we had a lot of attention in our interim report focused on how we help to improve mental health outcomes for Indigenous people. And included in that was how do we grow the workforce and Indigenous workforce able to provide that social and emotional wellbeing focus for their community. And we made recommendations of scholarships and various things that we thought were necessary to bring more people into the workforce, able to contribute to that response for their community. But we've also very much focused on that, and Alex has led this in relation to broader approach to diversity in our COLD community. So Alex, can I hand over to you to expand on where we're at in our current thinking?
Thanks, Penny. The amazing part of the Victorian community is that diversity is really becoming the norm. And for many young people, and really across the community, is that they don't fit into one group or another. People have experienced life and life experiences and that cross across a number of these segmentations in community. So the Commission has to think more broadly about, the technical term for it is intersectionality, but it just means that people aren't neatly packaged into any single group. And how does a service system become more welcoming, more responsive, more accessible to the community of Victoria as they are, not as they were 50 years ago, but as they are now and into the future. And so we've been working a lot with different aspects and different groups within the communities. And there's no doubt that there are important aspects about how does the mainstream become more responsive. And one of the questions that came up in the chat room in the last few minutes has been about, are we considering inclusion measures, and how are we going to keep it accountable, and how do we keep the mainstream more, as I say, welcoming to all Victorians, and a very important part of what we're thinking about. But also the important role of non-government, community-controlled, community agency, where I think that speaks a bit to your question, Mel, about how do communities and how are they supported to provide culturally appropriate responses that work within that community to not only support young people in this context, but actually support people across the age ranges. And the Commission is looking at the balance between community-specific and mainstream services. And also within that, as you say, this is a big question, but within that issue around community-specific responses, how do we support the leaders that are acknowledged and recognised within those communities to be able to provide support internally? And we've had some really interesting submissions about that. So, you know, the Friendship Bench is part of that, but various ways in which we can support people in the community to then support others. And that's been also part of our thinking. I've got to say, we're still working on this, where from a workforce point of view, we've been looking at how do peer workers work across the system, how do bicultural and bilingual workers work within the system, and how do we use both technology and, I'd have to say, we've got Auslan interpreters with us today, but how do we ensure that people can actually communicate effectively when they're accessing the system, not only around language, but around other challenges of communication? Many people with different forms of communication have real trouble with accessing the system. And so we've been thinking broadly about all of those aspects to make both the mainstream system stronger, but also support communities to provide greater capacity to support people in those contexts. The last thing is, you talked about the workforce. I think there's a lot of, you know, issues. We can put up whole new systems, but if we don't have the correct workforce to work in them, you know, it's going to be years and years and years before they become a reality. So we're thinking about how to support the workforce to get ready and be available to provide a more culturally responsive system. So I guess I'm just wanting to say, as you said, this is a big question, but just to say that we're thinking about it across all those aspects of governance, accountability, interface with the service system, and culturally appropriate at all those levels. And that's kind of where we're up to at the moment.
Thanks so much, Dr. Alex and Penny. It was so great to hear from you both. That kind of concludes the discussion section. We are running out of time, so I will move on and introduce you to Catherine Ellis. Catherine Ellis is the CEO of Youth Affairs Council Victoria and has over 25 years experience in senior positions across the private, public and not-for-profit sectors with extensive expertise in youth development, policy and practice. Catherine previously worked for 6 years in London as Director of Youth Affairs at the Commonwealth of Nations, working on youth empowerment, policy and programming across 53 countries with governments and youth leaders. So I'll hand it over to Catherine. Thanks, Catherine.
Thanks, Jen, and thanks to you and Mel for both moderating this session really beautifully this morning. And I want to start by thanking Penny and Alex for making the time this morning. They're of great interest in hearing what's happening and how the Royal Commission is progressing. And I think we're all really, really looking forward to February because there's great hopes that this time there'll be a system created that really addresses the many, many issues that young people who are facing when and even before they find themselves in a situation of psychological distress or mental illness. So I think it's been a really interesting conversation this morning. And the fact that, as Penny said, young people, 75% of incidences of mental ill health appear before the age of 25 just shows how important it is that young people and their needs and their ability to contribute to co-design and co-production are absolutely critical in this Royal Commission and in the system that gets implemented and is ongoing for years to come. The questions were really interesting, especially around co-design, and fantastic to hear so much thought is being put into how co-design can happen. And I know that Orygen, Pat McGorry and his team Orygen have been putting a lot of work into co-design as well. And we'll be really looking forward to seeing peer workers as a key part of the system going forward, as well as people advising on how the system should work. And the question around socioeconomic disadvantage as a risk and as a barrier, I think is particularly important. And we can't underestimate the toll that mental health really is the burden that it places on families and on young people themselves, trying to get help and trying to deal every day with the issues that they're facing. And so actually building that community approach in, I think is particularly important. There was a question I noticed in the Q&A around the role of youth programs in promoting social inclusion and mental wellbeing. And I really hope that that's part of the solutions that are developed as part of the recommendations from this report, because we all know that youth workers can play an incredible role in supporting young people, connecting them to services, identifying very early on when there might be issues. And we see that as a real part of the solution as well. And it can help reduce the cost, because the more we stop the issues happening upstream, the less need there is for the really serious clinical support, and that can be very expensive and very difficult for young people to access. And we've talked about technology, and the COVID incidence has really elevated that, and I think tested a lot of parts of technology and telehealth before anybody thought that it would become the norm. And that's probably been quite an interesting aspect for that to happen while the Royal Commission's going on. And we're hearing obviously from young people that a combination, a hybrid model is probably going to be the best going forward, but not to underestimate the fantastic role that technology can play. And the last question around the contemporary mental health system, it's fantastic to see so much thought going into how Aboriginal and Torres Strait Islander people can play a particularly important role in the mental health of their young people and their communities going forward, and that this is now being considered in terms of extension into the culturally and linguistically diverse communities. I hope also that it wasn't mentioned, but it's also going to be considered in the context of the LGBTIQA+ community, because we do hear from a lot of young people in that community that they want to see themselves and people who are very accepting of them in mental health services as well, and they are a more at-risk group as well. So I think that, you know, as we're going into this period where it's Penny, Alex, I know that you must be so busy these next few months designing such an important system, and Pat leading your expert team as well. And we want to thank you for all the work that you're doing. Thank you for coming today as well. It's so important to everybody on this call, I know, and thousands and millions of people beyond that. And we really look forward to a fantastic report in February and some really important outcomes for young people in this state. Thanks.
Thank you so much, Catherine. And that was a wonderful wrap up of such a rich discussion that we had. I just wish it could go longer, but unfortunately, time is of the essence and we do have to begin wrapping up for today. So firstly, if this meeting has brought up any distressing thoughts for you, please reach out and call some of the following services: Kids Helpline on 1800 55 1800, Q-Life Australia 1800 184 527, 1800 Respect, on the number 1800 737 732, and Lifeline 13 11 14. These contacts will also be sent out to you via email. If you're in immediate danger, call 000. On another note, we would love it if everyone attending this meeting stayed informed and involved with the Royal Commission and Youth Mental Health. You can find out more via the following resources. So firstly, the Royal Commission's Twitter, which is at RC Mental Health, and their website, www.rcvmhs.vic.gov.au. And secondly, there's Orygen's Royal Commission coverage on their website, which is www.orygen.org.au, and their hashtag Young Futures Matter. And thirdly, there's also YACVic's coverage on the Royal Commission and their resources on youth mental health, which is on their website, www.yacvic.org.au. And all these resources will be sent out to you as well. So you don't have to remember the gobbledygook of characters and letters there. So, handing it over to Jen to close up for today. So thank you very much, everyone, for being here.
Thanks, Mel. As Mel said at the beginning of today, you'll receive an invitation on how you can stay involved. So please keep an eye out for that. I'm also all for a bit of post-webinar self-care. So please make sure you look after yourself today and every day. But yeah, particularly today, you might like to do something specifically for yourself. I am personally going to go take my two very energetic puppies for a walk right now. And I encourage you to do something for yourself today also. In closing, I just want to say a final thank you to everyone who's been here today. Thank you to the panelists, Dr. Alex Cochrane, Penny Armitage, and Professor Matt McGorry. You've all been so informative and it's just been amazing. Thank you to all of you for tuning in today. Yeah, as Mel said, it's been such a rich discussion and so important, a very, very important discussion. Yeah, and I think that's it. Enjoy the rest of your day, and yeah, thanks so much, everyone.